Imagine if healthcare technology advanced at the same speed as healthcare breakthroughs. If the electronic health record was built to heal, not to just chart and bill, without the layers of complexity and endless clicks and provider burnout.
I'm proud to be on a team now that's going to improve healthcare for all of us. It's a moral obligation. And the line I use, if we can do it, we must do it.
For nearly 5 decades, Oracle technology has been used to run hundreds of thousands of the most successful businesses, safeguarded the world's most sensitive data, and accelerated the transformation of dozens of industries. Imagine what we'll do for healthcare. It's time to stop imagining. At Oracle Health, we've been building the future. Healthcare that starts before someone even walks in the door, that removes friction for the provider, the payer, the patient, where data is the linchpin for detecting disease outbreaks earlier, identifying better treatments faster, for connecting clinical care seamlessly to clinical trials so every patient helps heal the next. With AI working behind the scenes on routine tasks so provider time can be spent on human care. Imagine the future of healthcare for you. Welcome to Oracle Health Summit 2024.
Please welcome Seema Verma to the stage.
Well, good morning and welcome to the 2024 Oracle Health Summit and to Nashville, the future location of Oracle headquarters. So during our time together, we hope to offer you a glimpse into the not-too-distant future to show you how Oracle plans to transform healthcare end-to-end across the globe. And our agenda includes an all-star lineup with current and former government officials, not just me, our partners and customers, and you will hear directly from our chairman and CTO, Larry Ellison, and our CEO, Safra Katz. So this past year was filled with exciting developments. We completed the largest EHR implementation in the world for the United States Department of Defense, and we're working on restarting deployments with the Veterans Administration. And we've also demonstrated the power of Oracle engineering with the release of the clinical AI agent, which has documented almost a 50% reduction in EHR usage time. And the new Oracle Health Patient Accounting product automates scheduling and registration to increase billing accuracy. Health Data Intelligence, or HDI, has helped customers close more than 200 care gaps and increase annual wellness visits by up to 60% while reducing their cost by 12%. And this EHR agnostic product is so good that our competitors' customers are already using it. But let me briefly address the elephant in the room. So we're a week out from the 2024 elections. And elections always have consequences, and this one will be no different. And certainly the United States healthcare system has been profoundly shaped by the results of major elections, going back to the creation of Medicare and Medicaid, Medicare Advantage, the Part D program, and the passage of the Affordable Care Act. And in the UK, the historic creation of the National Health Service. But governments are not the only driver of change. Science and technology have played an even more significant role in shaping the economy and society, from the steam engine and electricity in the 19th century to semiconductors and microchips that sparked the digital age. But regrettably, both government policy and advances in technology have fallen short of driving the transformation that we all crave. Instead, our healthcare systems, while delivering astounding innovation in treatment and therapies, have become more complex, more fragmented, more expensive, and more difficult to access. I've always believed that well-intended government policy has often created more problems than it solves. And at the same time, the technology innovations that have fundamentally transformed other sectors of our economy have been absent in healthcare. I mean, healthcare is still using the fax machine. But I think you would all agree that today's most widely used healthcare technology, the EHR, electronic health record, has actually had negative effects on providers and patients. Too many clinical professionals have burned out, sold their practices, and lost their love of medicine, thanks to the robotic, soul-crushing, mundane tasks that current EHRs force on them. And moreover, today's EHRs, built on 1990s technology platforms, can't deliver any real innovation, forcing providers to seek a myriad of third-party point solutions. And these bolted-on products create multiple entry points for hackers and have left the industry highly vulnerable to cyber attacks, exposing sensitive data, even patient genetic information. And we're going to hear more about that this afternoon from Dr. Redfield, the former CDC director. So astronauts can live for months in a space station, but we still haven't figured out how to move and use digital health data effectively so that we have the information we need when we need it, and we can leverage it to make critical decisions for patients. And tragically, EHR data has been intentionally siloed, restricted from use across the entire healthcare ecosystem. And can anyone doubt that patients have been harmed by this, that clinical innovation has been thwarted? And I can tell you from my time on the White House COVID task force that this lack of data sharing made responding to the world's worst public health crisis much more difficult than it should have been in the 21st century. And too often, we didn't even know where to send supplies and medicine because we didn't have access to real-time data from hospitals. And this has got to change because it's simply not sustainable. But fortunately, I believe that we have reached a tipping point where digital technologies can finally deliver on the promise of transforming healthcare. And earlier this year, our founder, Larry Ellison, took the principled position that it's Oracle's moral obligation to fix the dysfunction of our current system. And I know what you're thinking, because I once thought it myself. Here comes another technology company thinking that it can fix our vastly complex healthcare system. But here's what's different. Oracle is positioned like no other company in the world to provide the healthcare system with a comprehensive set of tools and capabilities to reduce costs, increase efficiency, enhance clinical outcomes, and accelerate innovation. And the foundation starts with our heritage of managing much of the world's most valuable data with the Oracle database. And it continues with Oracle Cloud Infrastructure, our high-speed infrastructure, which provides a faster, more affordable, scalable platform for running mission-critical business systems. And moreover, the Oracle Cloud provides built-in protection from cyber attacks. Indeed, many of the world's biggest banks, retail and hospitality businesses, communications companies, government agencies, including the intelligence community, trust Oracle technology to protect their data because of the powerful security our cloud offers. Oracle Health is at the center of the exploding AI revolution, and we are leveraging our top AI engineers to work on our healthcare portfolio. And this gives us the unique expertise that we need to harness the power of AI. And we've also learned from the mistakes of those that have come before us, and we have the humility to recognize that we need the knowledge and experience of frontline clinicians and administrators to help us develop state-of-the-art products. And finally, Oracle is the only technology company that has demonstrated their commitment to healthcare with the acquisition of the largest EHR in the world. And Oracle also has a suite of applications to address the full spectrum of a modern company's everyday business functions, from finance to HR, supply chain management, and we're designing new versions of these products to integrate with the EHR to help increase the productivity and efficiency the industry so desperately needs. Oracle's approach to the future of healthcare is best described by the computer scientist Alan Kay when he said, "The best way to predict the future is to invent it." The Oracle reinvention of healthcare is guided by a set of core principles. First, we are committed to putting patients in control of their medical data and ensuring this highly sensitive information is safe and secure. And that's why earlier this year we announced that we'll move all of our customers to our highly secure Oracle Cloud at no cost to them. And this provides the same level of security that Oracle provides to the intelligence community. And we're committed to leapfrogging our competitors with groundbreaking, innovative technology that provides a contemporary experience, one that is intuitive and as easy to use as online shopping, without a lot of clicking and cutting and pasting, endless menus and tabs and drop-down boxes. And most importantly, it won't require hours of training or years of implementation. And another principle is centered around interoperability. We are dedicated to breaking down data silos to not only facilitate a connected healthcare ecosystem, but to also facilitate transactions across that system. Our products will eventually be EHR agnostic so that everyone can take advantage of Oracle innovation. And finally, while we will embed AI solutions at our most foundational level of our products, we believe that AI should complement but never replace the expertise and decisions of human clinicians. While a bot or a machine can confirm that someone has cancer or their mother has Alzheimer's, no one wants to be comforted by an algorithm. Medicine is both an art and a science, and the art is about compassion and kindness and empathy, about creating a bond of trust between patient and provider. And the art also encompasses judgment based on experience and expertise. And humans still have a unique ability to discern the significance of the outlier and the exception. And that's why Oracle products will always give human clinicians the final decision about their patient's diagnosis and treatment options. So you're going to see how all of our products are being shaped by these core principles. The essential backbone of a digital, data-driven healthcare system must be a completely reimagined EHR. And so today, I am proud to announce that such an EHR is no longer a vision, a promise, or an engineering concept. It is, in fact, a new reality. In 2025, Oracle will deliver a brand new EHR that will redefine the future of healthcare. The breakneck speed at which we have built this new EHR is an engineering triumph. But it's a misnomer to even call it an EHR because it's no longer a record-keeping system, but instead, it's a dynamic, evolving system of intelligence that spurs action to ensure better patient outcomes. And for the provider, it's not a scribe or an assistant. It's the doctor's best resident. It's the administrator's most productive analyst. It's the researcher's best trial recruiter and the payer's most efficient partner in authorizing treatment and reimbursements. The new Oracle EHR uses AI to seamlessly permeate the entire clinical workflow from beginning to end, bringing powerful insights and automation to every process. And while today's EHRs dictate workflows that force providers to deliver care in a one-size-fits-all approach, the new Oracle EHR empowers providers to create personalized workflows that can adapt to change. Empowered by real-time insights, the Oracle EHR will help clinicians form personalized care plans based on precision medicine that match the genetic makeup and lifestyle choices of every patient. And to be clear, this isn't a refurbished Cerner EHR. Because in this day and age, you can't leverage modern technology by bolting new innovation to something built in the 1990s. And that's why this new EHR will incorporate our clinical AI agent with its voice-activated navigation and search capabilities. We want to re-energize our workforce and increase their productivity, allowing them to meet the demands of the world's aging populations. And it's also going to embed our Oracle Health Data Intelligence, or HDI product, which creates longitudinal patient records by bringing in data from more than 3,000 data sources and enables users to conduct sophisticated and customized analytics and benchmarking. With HDI, clinical insights are added directly into patient summaries, including options for closing care gaps, nudges to improve star ratings, and other quality requirements, in addition to tracking cost and utilization. And the Oracle EHR will lead the market by including all the tools needed for providers to participate in value-based care, which should help accelerate adoption of this care model. And our new EHR will also incorporate the Oracle Command Center, so providers can track patients when they're in the clinic or in the hospital, reducing patient flow bottlenecks and allowing the staff to work more efficiently. And its embedded analytics and benchmarking capabilities will allow staff to review real-time facility performance and design improvement plans when needed. And the Command Center will also connect devices, both inside and outside the clinical care setting, so providers can have real-time data on their patients. And as part of our reimagined EHR, we're building a patient portal, where a patient's entire medical history is collected and maintained in one place. Because patients don't care what EHR their doctors use, but they do want access to all of their data and to control who can access it and exactly what information is shared with whom. And so our portal will allow them to do exactly that. It'll let them combine data from their wearables, remote monitoring devices, and other healthcare apps for a complete picture of their health. Today, if we're lucky, a patient portal is just a place to make appointments, get test results, and pay bills, standard stuff. But at Oracle, we see the portal, the future portal, as a comprehensive patient engagement tool, one that helps them understand their health, their care plans, test results, and gives them control of their healthcare experience. Because we all know that it's not just providers that are tired of the complexity of healthcare. And so to this end, Oracle will provide patients with their own AI-based interactive voice assistants to answer questions, confirm appointments, remind them to take their medication, and to even request prescription refills. And so if the EHR is the provider's best resident, the patient portal is the patient's best healthcare guide. And while we are enormously proud of the new Oracle EHR, we know that transformation doesn't come from one point solution. Many patient and provider burdens stem from the increasing friction between them and health insurers. And this friction is not just frustrating, it also represents, by some estimates, as much as 25% of US healthcare costs. And as the person that ran the largest payer in the world, it often felt like all the back and forth didn't actually contribute to better patient care. And let's face it, most prior authorizations get approved anyway. So maybe it's better to focus resources on the outliers and leave the routine work to robots. Oracle is reimagining a future where secure payer-provider transactions occur directly from the EHR. And to this end, we recently announced the Oracle Connection Hub in our claims, prior authorizations, and payments program, which will support the exchange of data with any EHR to any payer, all using military-grade security. And the Connection Hub will also leverage HDI to help payers and providers collaborate to increase star ratings and close care gaps. The Hub demonstrates our commitment to our core principles around interoperability and security. But this commitment isn't new. I can tell you that Cerner was one of the only EHR companies that did not fight my efforts while I was the CMS administrator to advance interoperability, FHIR standards, and open APIs. Other EHR companies pushed back viciously to protect their profits, putting patients' lives at risk. And I think that that was a shameful, epic failure in judgment. It really was. And for that reason, I am especially pleased to announce today that Oracle Health will submit its application to become a Qualified Health Information Network, or QHIN. Our QHIN will provide an on-ramp to the National Healthcare Interoperability Network to allow providers and patients access to data that's necessary for treatment and care. And our QHIN will secure patient data by taking advantage of Oracle's unique leading security capabilities, and will also enable broader functionality than other QHINs because we'll be doing imaging and advanced data sets. As part of our principle to advance innovation, Oracle is on a mission to bridge the gap between clinical care and clinical research. Our goal is to do our part to help reduce the cost of clinical trials and to make drugs more affordable. Today, only 3% of patients and 5% of physicians participate in clinical research. Patient recruitment is 30% of trial costs and is a key contributor to whether a trial fails or succeeds. But we believe that that number can change dramatically. And to that end, Oracle Life Sciences recently released the Clinical Trial Site Feasibility and Patient Recruitment Service. With permission from our health system customers, this product uses EHR data and AI to determine sites that offer investigators the best chance of filling their trials quickly. And meanwhile, our patient recruitment service, which will be a part of the new EHR, can automatically link the right patient to the right trial as part of providers' regular clinical workflow. Inefficiency is another major contributor to the rising cost of clinical trials. And trials often require extensive manual data entry between the EHR and clinical trial systems, or EDC. And that's why Oracle, the only company to own systems that span healthcare and life sciences, is perfectly positioned to streamline the two. We are building an AI-embedded solution that will eventually eliminate the need for duplicative data entry across EHRs, EDC, and pharmacovigilance. Our approach is EHR agnostic and will ensure the accuracy and integrity of clinical data across the entire research ecosystem. And we plan to unveil this new capability later this year, and in 2025, we will release the brand new Oracle Clinical Trials Suite, which will help researchers design their studies through a digital protocol connected to our full suite of clinical trial tools. And after we complete our full rollout, every clinical trial customer will be automatically connected to every Oracle Health EHR customer out of the box, setting the stage for even faster clinical trials. And to further innovation, we are introducing our new Analytics Intelligence for Life Sciences product. This cloud-based, AI-infused analytics platform will enable biopharma and medtech companies, CROs, regulators, and health systems to gain insights into a range of research questions using de-identified data, real-world data from the EHR, including omics data. So clinical trials won't have to end when a drug receives approvals, as our platform will enable researchers to follow patients over the long term to discover new opportunities and indications. And we believe this will accelerate the timeline for clinical research, enable real-world assessment of patient outcomes, and reduce the cost of trials and medications. And finally, Oracle is addressing the new challenges for healthcare systems with the new Oracle Public Safety Suite that uses AI to identify suspicious actors and detect weapons in any healthcare facility to keep our patients and our workforce safe. With all of these new products coming to market, we expect demand to be high. Oracle will prioritize our customers who are on the Oracle Cloud to receive the new products. And later this year, we're going to launch a program to leverage the ecosystem of Oracle partners to help accelerate implementations, so our customers can choose our team or an independent system integrator to ensure a successful deployment. 2025 will be a momentous year for healthcare. It will be the year that Oracle delivers a comprehensive suite of products that demonstrate our commitment to our principles: patient rights, cybersecurity, interoperability, innovative and intuitive products that are easy to use and easy to implement. And these principles are nothing short of revolutionary for the healthcare industry. But the revolution won't stop there. By leveraging the power of artificial intelligence and machine learning, Oracle will let humans be humans, while machines do the mundane, repetitive work of machines. We will free the system from inefficiency and burden to lower cost and to delight end users. And this will mean more time for providers to spend with patients, looking them in the eye rather than a computer screen, delivering quality care and empowering them to be the healers they trained to be. This evolution will create a new future for health that is beyond anything that we can predict today. And imagine if all of us as patients were empowered with more information about our health. Imagine if public health had the ability to detect disease early and stop pandemics in their tracks. Imagine if value-based care functions at scale. And imagine if governments and employers weren't encumbered by rising healthcare costs. Imagine the pace of personalized medicine and treatment when researchers have access to real-world data. And imagine if we can reduce the cost it takes and the time it takes for clinical trials. Imagine what the future looks like. I think it means a better, healthier future for all of us and everyone we love. But at the end of the day, seeing is believing. And so we're going to be doing demonstrations of all of our new products. And I'm going to end my comments today with a short video giving you a glimpse into the future of healthcare that we aim to invent with all of you. Thank you.